and welcome to the Brinker Leadership Series, Extraordinary Leaders in Extraordinary Times, brought to you by Adi Partners. As founder and chairman of Adi Partners, I'm delighted to bring you this episode of our leadership series. I am Sanjay Viswanathan. COVID-19, the pandemic of this millennium, has changed our lives irrevocably. At the firm, we believe people fighting this pandemic at the coalface in healthcare, travel, supply chain, government, non-profit, and media deserve recognition. As a global firm across Asia to America, with 19 offices in between, that creates value through technology, I am pleased that Adi Partners has conceived this program.
In fact, over the next several weeks, we will identify and share world-class practices to combat COVID-19 and create cohort of champions who can influence and energize the war against coronavirus. I am Hiral Desai. Through the Brinker Leadership Series, we will identify extraordinary leaders in these extraordinary times. It's very similar to legendary 15-year-old boy who mythically saved his nation from being flooded. This series will provide everyday leaders a platform for sharing of best practices and appreciate their efforts in the fight against COVID-19. Our journey will take us to India, Middle East, UK, Europe, America, Far East, and China.
As mentioned in the prior episode, the amazing thing is Indian origin doctors are the backbone of UK's publicly funded National Health Service, the NHS. There are approximately 65,000 Indian origin doctors in the NHS, 70% of whom trained in India. There is mounting concern, as we hear on the ground, over the unfair treatment in the context of COVID-19 against Black, Asian, and minority ethnic people, as it's called the BAME in the UK. Today, we are delighted to have with us Dr. Hemadri Makani, Consultant General Surgeon at Northern Lincolnshire and Goole Hospitals, NHS, and a leader in the fight against COVID-19. Welcome to the show, Hemadri. We are delighted to have you with us.
Thank you for having me.
Thank you as well. Himadri, let me take my first question to you. There is a lot of confusion that everyone thinks as to what is the role that surgeons are playing with regards to COVID-19. If you could just help us understand, how are you contributing and how do you think surgeons can contribute to this war against COVID?
Thank you. So it's a very interesting question. The reason is that while doctors, nurses, healthcare assistants, we are all right front line of fight against COVID-19. As surgeons, we may be considered slightly away from the front line. However, right now, there is no difference there's no identification of what exactly the front line is, because every person who steps into a hospital, in fact, every person whom you may come across in public transport or in any public place is potentially suspect either as a COVID patient or as a COVID carrier, symptomatic or asymptomatic. So, as surgeons, we are right there dealing with our day-to-day work. We still have patients who may or may not have COVID, but they are still coming in with their normal surgical emergencies. You may have an appendicitis, you may have an abscess, you may have a gallbladder situation, any of those sorts. So they are still coming in, and we still have to treat them. And under the circumstances, we don't know whether they are COVID positive or not, and yet we have to provide them the most appropriate care that we can. Another big worry is we have postponed. We are not currently performing any planned elective surgery. Even cancer surgery is on a slow boil, in the sense that people with cancers who are about to turn into emergencies are only being operated. So there is a lot of anxiety amongst patients, and understandably, we are anxious too, because we may be delaying the diagnosis, we may be delaying the treatment. So that causes a lot of anxiety. So essentially, We are there. And now there is another aspect.
Mm.
If the proverbial hits the fan, we will all be redeployed from our surgical roles into supporting roles for our intensive care colleagues, for our
Mm.
cash
Mm.
colleagues, and for our medicine, acute medicine colleagues. We have been trained for that, and we are prepared to do that as well. So that's the part of the surgical story of being in the front line.
Right, and that's an interesting story as well because changing roles in times of necessity is something that everyone is looking at. As you mentioned, I'm just picking up one point over here is that your normal daily, patients are walking in. But is there a difference in the number of surgeries that were done pre-COVID and now during the COVID era, especially the walk-ins that you're seeing?
Yes, with the elective situation, with the non-emergency patients, obviously, as I said, we are not doing much of that. We are very, very choosy. We are very, very selective. With the emergency situation, we have to adapt a lot of our practices. Obviously, where it is a complete must. So we go ahead and operate, and we take extraordinary precautions to protect the patients and ourselves. However, there are things that we have modified as a part of this new COVID situation. For instance, we used to operate on every appendix, whereas now we consider whether this patient can be treated with a strong antibiotic, let it settle down, see how they go, and so on. Same thing with the gallbladders. We used to go, anybody with a sharp gallbladder pain, our protocol was going towards operating on them within the first 72 hours anyway. We stopped doing that. We say, okay, we will treat you conservatively, and when the COVID is over, then we will operate. There's a simple reason for this. Now, if a patient develops COVID after major surgery, after a general anesthetic, their mortality rate goes up tremendously. For instance, in most standard elective surgery, if we spoke about a 1-2% mortality rate, most people will really be concerned about that. Whereas with the COVID situation, after general anesthetic, if you were to have a COVID, the mortality can be as high as 20%. So it is a huge big deal, and therefore we have to be extraordinarily cautious. We are modifying our practices in dealing with emergencies as well.
Right. A relative question over here. I mean, it might sound slightly insensitive. How has the business of surgeons been impacted due to COVID? I mean, how do you deal with that?
Yes, in the UK, 90% of all healthcare is delivered by the NHS, which is completely state funded. Therefore, the actual business of operating, the actual business of surgery carries on, so to speak. For instance, this morning I was doing a virtual clinic. Using computers, using telephones. Some of my colleagues are using video calls in medicine and dermatology, in general practice. They're all using video calls. So the work goes on. But if you're talking in terms of private practice, which is relevant to America and India, definitely my friends in India tell me that they haven't been operating on any elective patients and very, very few emergency patients in the last month or so.
Right. So that's an interesting take on that front. With that, now surgeons in Hemadri are working, I mean, they are very much used to working in high stress, high pressure environment. In that context, how is the current situation for surgeons in the UK and elsewhere?
It is even higher stress because previously it's the stress of dealing with the blood and the gore and all that goes along with it. Now in addition you have the COVID and whether the PPE, personal protective equipment, is actually appropriate or not because there are a lot of controversies around it. We may get to talk about that. So it is actually, even though the volume of work has gone down substantially, the stress levels and the anxiety levels associated with it has gone up tremendously.
That's really unique, Hemadri. And when we hear about, looking at how the BAME community in the UK is involved with the healthcare sector, and then when you look at how they are seeking justice, could you tell us a little about what you do for them And how are you helping this community cope with COVID in the current context?
I think the first thing to understand is all over the Western world, the BAME or BME communities do have poorer healthcare outcomes. Now, some people attribute it because a lot of the BAME group have poor socioeconomic status, and that is associated with poor healthcare outcomes. Uh, However, when we come to COVID, there are a couple of things that we are seeing. We've got to be completely honest here. Uh, the 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 COVID affecting the BAME population as such. Yes, it is worse, but it is not completely out of sync with what normally happens. For instance, in the UK, there are about 14% of the population can be classed as BAME group, whereas the number of people affected by number of hospitalizations due to COVID seems to be around the 19%. So it is higher, but it is only slightly higher. However, when it comes to healthcare staff, that's where we are seeing a lot of issues with, if my numbers are actually right, which I think it is more or less right, 22 out of the 26 doctors who have died so far have all been from BAME backgrounds. And if you take the whole of healthcare workers as such, including doctors, nurses, healthcare assistants, porters, pharmacists, then more than 60% have been BAME. Whereas if you look at the NHS staff as such, the doctors account for about 38 or 40% as BAME, and generally in the NHS, it is approximately around 20% as BAME. So that is the context. Now, what we have done, there are things that I have done personally at my place of work, and then I contribute through an organization called BAPIO, British Association of Physicians of Indian Origin, in dealing with these issues.
Fascinating, Hemadri. And earlier on, Hiral had referred to the aspect of technology, especially aspects like AI and robotics and so on. We're obviously seeing the emergence of telemedicine during this period, and you referred to some of the virtual elements of clinical intervention during COVID. What is the implication of the emergence of these technologies for the BAME community?
On the positive side, for healthcare as a whole, moving into technology and healthcare, in my personal view, has a very slow, reluctant uptake of technology. So moving into this, we might be forced by the COVID to move into the technological era, which is good. I can give you examples in a minute, but in terms of BAME community, my fear is, like any access to healthcare and like any affordability issues with healthcare, they may be left behind. Now, to even counterbalance that, if we use the right kind of technology, they may not be left behind. So if we use bespoke technology, then they may be left behind. But if we adopt existing technology, then they may not be left behind. That's my view on the BAME perspective. Now, I did say that we can speak about what is happening in terms of technology itself. Fascinating things are happening. For instance, a lot of people, even though the NHS is not supplying it, those who are in the know have got what's called pulse oximeters, which means you can put a little ring on the tip of your finger and that it reads your oxygen levels.
Correct.
Now, somebody with a fever due to COVID, if your oxygen level falls, you can still be very happy apparently with that, because you are happily hypoxic. That's what they say. Your oxygen level is low, but you're still happy. And that is actually quite a dangerous condition. So if your oxygen level falls, you should be seeking professional help. And how do you identify that? And people in the know have already bought through eBay and Amazon and all that pulse oximeters. They're extremely sensitive and they're relatively affordable as well. You just click that on when you have a fever and it will tell you. And a lot of, for example, infrared temperature checking.
Mm-hmm.
Not enter anybody's home. So you just ask them to come to the door, shine an infrared on their forehead, it tells you the temperature. There are plenty of technologies like this, and they have uh, algorithms, they have apps which matches symptoms with the rest of the population. India has done, India in London, they've done an app like that. It is working quite well. It's not the best app in the world, but it is working quite well. And I believe the Indian government has an app like that to track COVID cases. And my friends tell me that again, it's not the best thing since sliced bread, but it's working quite all right. So there's a lot of optimism in terms of technology and going forward. We are doing virtual clinics. We are doing video consultations. We have changed practices. We are doing investigations before we see the patients,
Mm.
which we have actually a better idea when patients come to us face to face. So there's a lot of, both in terms of technology and in terms of the process by which we use the technology is changing, and I feel it's changing for the better.
Right, and that's a great insight that we're picking up as well, Himadri, because yes, technology is the next big thing that everyone is looking at. If you could just help us understand, now a lot of steps that have been taken. One thing that everyone discusses is the lack of preparedness of the country and the healthcare system in handling a crisis such as this. How could we have been prepared for a pandemic like this in a better way?
It's fascinating question. I'm not the world's expert on that, but I've been following very closely some of the complexity experts on this, and I use that information for myself, my family. So thank you for asking the question. Now, in a pandemic, first of all, it's not about the technology, it's not about the processes, it's not even about the healthcare.
Okay.
It's about how you think about it.
Hmm.
Now, under normal circumstances, if you were my patient, you come and see me, we have a chat, and then we do the basic tests. And then we step up and do a few advanced tests. And then we step up and we do a few invasive tests, which means we scale up.
Okay.
Whereas in a pandemic situation, it should be the exact opposite. We should throw everything, including the kitchen sink, at it, and then we scale down, which unfortunately, a lot of people miss that trick. A few countries did that trick, and they are doing quite all right. For example, New Zealand, shut down things very soon. They were very strict. Australia did that. To some extent, South Korea and Singapore did that. And to my great amazement and appreciation, India has done that, even though in a large country, highly densely populated country like India, even if
Right.
you do that, you can slip, you can fail. And I think that's what is happening right now. There is a community spread that has started, and I have my worries and concerns about it. Now, in America and in the UK, we missed the boat. We did not use the what's called the precautionary principle.
Okay.
Precautionary principle is where you don't wait for evidence. You assume that things are going to be bad. You hit it with everything that you have, and then you knock things off as things get better. We didn't do that, and that is why it all went really topsy-turvy. If we'd done that, we could have planned things, and even all our resources would have lasted in a manner that is far better than now. There's another thing, of course, because we were coming out, in England, we had this austerity for nearly a decade now. So at that time, the preparedness did slip. So, for instance, there was a lot of PPE available, but some of them was expired stock, and so on. The austerity had an effect. The economy not doing brilliantly, that had an effect. But I think primarily there was a failure of thinking because public health always acts on the precautionary principle and on this occasion.
Right. That's an interesting take as well as to how you've compared different countries as well as to what was done right, what was done wrong. But now, if you have to foresee the future, do you think a pandemic worse than this can hit us? And if it does, what are the few learnings that we need to keep in mind from the current mistakes?
Again, I'm not the best bet to answer that, but I can give you a borrowed answer. This comes from our current very famous philosopher Nassim Taleb, the author of Black Swan. He has actually said that this pandemic is not a black swan. The next pandemic, at least what he's saying, is a bacterial infection for which we may not have treatment. We are running out of antibiotics. We are running out of antibiotics that can hit the right bacteria, and he seems to think that the next big thing, black swan event, will probably be a bacterial infection. Now, okay, you can take that as the next event could be even bigger, could be even worse. Now, whether it is in terms of volumes or impact and all that, we can debate that. Now, what happens is when you're talking about the next pandemic and what we can do and what we can foresee,
Mm,
it's travel very fast.
correct.
Now, disease is traveling at the rate of your internet communications these days.
Mm, mm,
Previously, when you have a pandemic, you have to get into a big boat or a ship and then cross seas, and then by the time you reach, it spreads very slowly. You have time to think and all that. By the time we have finished this discussion, the next pandemic maybe would have already started, because where it started, the person would have already moved.
correct.
So we have to start seriously thinking about again, maybe Sanjay will know much more about this. You might know much more about this. So we have to start thinking about a bit more of localism and temper our ambitions on globalism. Is my personal view. I mean, obviously, I'm speaking out of my medical hat here. This is not medicine, but I think we should start thinking about localism a bit more. That way, we'll be able to cope with these pandemics in a slightly better manner.
It's fascinating you mentioned that, because that leads us to the next thought that I wanted to get your views on, Hemadri, which is really around the society of people that we all live in. We're already seeing a dramatic shift in social modes. For example, people are not going to be shaking hands as often. The Indian Namaste is going to become the global greeting of choice. Where you mentioned the masks and gloves. I mean, this is going to become par for the course for all of us in daily life. And then when you think about some of the social norms and behaviors we were taking for granted, such as going to a cinema hall to watch a movie, go to a retail mall, theme parks, and other aspects of social aggregation, which we think when we talk to sociologists and anthropologists, they all believe that that is now going to become a thing of the past. So, while there is a dramatic shift in society, how do you see that shift happening in your sphere of influence, especially in the area of surgery? How are you now, and given that you're going to be exposed to some of this a lot more than many of us, how would you protect yourself in this new era of social distancing?
Yes. Now, in surgery, the technology for distancing is actually already available. I hear, and I think I can even, not more than hear, that one of our former health ministers, Lord Era Darcy, used to have a robot which does the round for him. So I can be sat exactly, and those are already available.
Right.
I can be sat at home, and I can have my robot doing my ward round, and they can see me. I can see them with tactile robots. I can even touch them, and get all the information that we want. So that is available. Now, robotic operating is already available. Even though it's not available in my hospital, very near, 30 miles away, we have robotic operating as well. So the robots does the operation, the surgeon sits in a console and does that. Now, remote robotic operating is also available. They have piloted it in Canada, so I can program and I can send it off, and I can sit at home and do the operating. So in that aspect, the technology is already available. It is whether it becomes affordable for use and whether there is enough social acceptance. At the end of the day, we know best feeling for the patient is when they sit with their doctors and nurses. In difficult times, you hold their hand or touch their shoulder, and those reassuring words, that comfort of the touch, the comfort of the physical person sitting near you, has always been important for time immemorial. Now, how that will change, how people will accept, we don't know, but the technology is available.
And what, according to you, Hemadri, will be the new normal in this post-COVID era?
Post-COVID era, it is that we will struggle for the new normal. I wish there isn't any specific post-COVID era in terms of social interactions. Human beings for 3,000 years have been living in agrarian societies, which means they live next to each other. They like to mingle. They like to be physically close with each other, and so on. So I hope in a social sense we don't really see, even though you could do with a little bit of a less of a crowd and less of crowded places. Hopefully the buses don't get too cramped. They let only enough people into the bus or into the trains that people don't catch illnesses. So I think that bit is important. I hope people do that, but I hope otherwise people remain as social animals. But in terms of uh, offices, in terms of factories, in terms of healthcare, there is undoubtedly going to be a change. For instance, in Chennai, in Stanley Medical College, where I studied many decades ago, they are now having robots to help nurses
Yeah.
deliver patients to COVID patients. So it's already there, in India and Chennai. So, but undoubtedly there will be an emphasis on technology. There will undoubtedly be an emphasis on virtual and remote consultations in almost every aspect of healthcare. There is no doubt about it.
Terrific. Well, that was a very erudite conversation, Hemadri. Thank you very much for your time and thoughts. And we look forward to keeping in touch as we build on this dialogue of the Hans Brinker program, because after all, this is about extraordinary leaders like you in these extraordinary times. Thank you.
Thank you, Sanjay. Thank you, Hiral. Hope to see you again.
Indeed.
Thank you, Hemadri. In fact, that was a fascinating and insightful discussion, Sanjay, as well. In fact, thank you, viewers, as well, for tuning in. Sanjay and I will be back same time, same day as well, to share more about extraordinary leaders in these extraordinary times. See you soon.
Thank you.